But right now we're going to switch gears and we're going to talk about kidney stones. We have Dr. Travis Bullock with the Incontinence Institute.
How are you? Good morning or afternoon.
Yes, good afternoon. I'm doing well. How are you doing?
I'm doing great.
Good. Now,
they're very common. It's sort of estimated that your lifetime risk, so the chances that a given person is going to get a kidney stone in their life, 15% of people have a kidney stone in their lifetime. Fortunately for you and a lot of your listeners, 80% of those people are men. So they are
something men get. We don't get.
Finally.
Yeah. I mean, I had a girlfriend that got one, and I was really surprised. But she was also. Can you talk a bit about like some of the risk factors? That
there's sort of lots of risk factors to stone formation, and the biggest of all the fluids. And where I think coffee really plays into there is, coffee has caffeine. Caffeine is a diuretic, and that diuretic makes your body. The other big risk factor for kidney stones is high salt diet. A lot of people think if I eat a lot of calcium in my salt diet, makes you at more risk for kidney stones.
Okay.
They actually did some studies, and actually a low calcium diet, because there's this other sort of substance in things we eat called oxalate, which also makes kidney stones. And if you eat calcium, get calcium.
What's oxalate?
So oxalate it's something it's in normal foods like green leafy vegetables. It's saccharin or some sort of man-made chemical. It's actually a naturally occurring substance.
Oh, okay.
But a lot of kidney stones are made out of our normal diets.
Okay. Now I've read that oxalates or chocolate is an oxalate-rich food.
So the sort of like iced tea has oxalate. Chocolate, unfortunately, has oxalate. Peanut butter, rhubarb, but I don't know a lot of people that eat rhubarb.
Yeah.
And then some of the green leafy vegetables, kale, spinach has oxalate. But the sort of big ones I tell chocolate, but sometimes you got to have something nice.
Well, yeah, and that's the thing, though. I mean, rhubarb, I would imagine, is got to have some good health. Should people be cutting out, anything that has oxalates, or what's the right...
So I try not to get too psycho about the oxalates. Really, the number one thing you can do is just keep yourself hydrated.
Okay.
Now, there are some foods which are rich in something called citrate, and risk factor for stones, because the citrate is good for the urine, and things that have this citrate in it are pineapple juice, orange juice, a glass or two of lemonade a day. Now, you don't have to fresh squeeze lemons, but a lemon product is, because that actually doesn't have the citrate. It should have real lemons. Some people get nervous about the calorie content of lemonade. On her fridge, that stuff, real lemon. Then that green bottle that was super sour.
Yeah.
On the back of that real lemon, there's a recipe for lemonade, source of citrate, which will also decrease your risk of kidney stones.
Now, how much are we talking? Because I actually always, whenever we go to a restaurant or something, I always ask for a lot of lemon, and I squeeze that. So how much are we talking about?
I think that would be a sufficient amount right there.
Okay.
I mean, we can give you pills also to put citrate in your urine, but in cup set.
Okay.
So I tell people, if you like lemonade, that's the perfect thing to drink.
Oh, okay.
So it seems like these things are, kind of
current kidney stone former, but there's not a real lot of evidence out there that says if you're not someone that makes kidney stones that you need to make a lot of dietary changes.
Right. Very painful. So what do you do to treat these?
So lots of things. So a lot of kidney stones can pass on their own. I always think it's you have to take
bunch
some
of whiners.
The male version.
Those men are doing.
They have no idea. Is like the pinnacle of pain. I guess sometimes several times throughout their life, and you make that the pinnacle of pain.
Yeah.
But anyway, there's lots of things. A small kidney stone, like maybe pass on their own. And so if you go to this doctor or the emergency room and they diagnose your kidney stone, a lot of times we can give you a pain medicine and where you sort of strain your urine to try to catch the stone. And some smaller stones can sort of pass on their own.
Okay.
Now, there are situations where it's going to pass, or maybe you've got a urinary infection, or maybe you're in such severe pain you need something to intervene on the kidney stone.
Okay.
And fortunately, the surgery we do for kidney stones now is not very invasive. Incision on your side or back to get a kidney stone. We don't have to do that very often, fortunately, anymore. One of the things we do now is something called lithotripsy anesthesia, but actually we use high-frequency shock waves, so sound waves that travel through your body and can break up a stone, and very effective. Other things we can do is something called ureteroscopy, which is it's a surgical procedure, but we don't make any cuts on it. Then look up the kidney
What
tube.
every guy wants.
Yeah. luckily you're asleep while you do that.
Is it a small telescope?
Yeah.
I'll let it go.
Feel free.
I'll let it go. I always feel like I get myself in trouble when we do these. So we go inside and take out the little pieces.
Okay.
And then for the really, really big stones, we occasionally will need to even go through and get the kidney stone and pull it out in larger pieces. But that's only for the really, really large kidney stones.
Now, how big? What is?
You're going to see are going to be in like the 3 to 5 millimeter range. So you've seen millimeters on a little ruler, small little marks. When you're passing a kidney stone, very small. Those 3 to 5 millimeter ones a lot of times will pass on their own. But I mean, I'll routinely see kidney stones the size of a ball filling up the entire kidney.
Okay.
Wow.
Oh, wow. Holy smokes. Now, why is it that guys tend to get these more than women?
Just because maybe guys are maybe a little bit more dehydrated. Guys are probably less likely to present to the doctor when they're at higher risk. Just their chemistry, they're probably a little more dehydrated. Maybe there's a little more salts in their urine, which makes them more prone to stones.
Calcium supplements are potentially problematic.
So calcium supplements can potentially, I said dietary calcium supplements can be a risk factor for kidney stones.
Okay.
And we generally say that, I'm a sort of proponent of calcium supplements, especially for around a gram or 1,000 milligrams or 1.2 grams or 1,200 milligrams. Should probably keep your calcium intake to about 1,000 milligrams or maybe 1,200 milligrams.
Okay, so if you're saying, that whole adage of
up to a point. Now, granted, if you're in your 50s, if you're postmenopausal who's never had a kidney stone and you're taking it for, but if you are, if you've had stones before and you're a recurrent stone former, it may be something that you might want to have monitored by.
Wait, would you say probably women are safe with calcium supplements because since it tends to be more, kidney stones tend to be more of an issue for men?
I would say in general, as most people, even given the risk of kidney stones.
Okay.
So how common are these?
Oh, kidney stones? Always in the ER. But generally about 10 to 15% of people will have a kidney stone in their lifetime.
Okay.
And then those people who have a kidney stone.
Oh, okay.
So definitely recurrence is a definite issue.
Okay. Now, I've heard that, I've read that if these...
They definitely run in families. And people whose parents have kidney stones are at higher risk for kidney stones. And there's actually a few genetic abnormalities, hereditary hyperoxaluria, which these people have definite kidney stone. It's a definite genetic cause of their kidney stones. And a few rare genetic illnesses, which their main presentation is kidney stones.
Okay. All right. Now, and what exactly is a kidney stone?
Sort of aggregation of crystals or solids from the urine. Usually calcium is one of them, and then also most common, or a calcium oxalate stone is the most common. And then basically it's salts from the urine. There are some other types of stones, substance called uric acid, and people with gout tend to get this. This is people who eat a lot of meat may get this because of this uric acid.
Oh, okay.
There's another type of stone called struvite, which we call an infection stone, and that's actually made by a product of the bacteria from an infection, and it can make a stone.
Okay.
And then there's a really rare one called cysteine. We don't really see these very often, and that's
Incontinence Institute about kidney stones. And is there anything else, any final things that you think people should know in terms of kidney stones?
I guess the number one stones are not about 2 liters of fluid a day is going to be what you need to keep your urine sort of dilute so you're not at risk for kidney. Second best is probably lemonade. You hear a lot about soda, and soda can be a factor also, but definitely water's the best. Keep yourself free of kidney stones.
Okay. And actually, also one final thing. When should someone see, what are some of the signs?
And it's generally a pain that's going to drive you to the doctor.
Okay.
I mean, they describe it as a crushing pain that sort of takes your breath away. 20, 25 minutes of this intense pain and nausea and feeling like you're going to throw up, and then it will sort of relax and go away. Mark of kidney stones. Maybe some blood in the urine, but not always. But it's usually the pain in your back, usually on one side, and a lot of times people are get me to the ER now.
Okay, so it's not like somebody's going to have a kidney stone and they're just going to ignore it.
No, not generally. They're just like that.
Now, if people want to learn more about, kidney stones and to get treatment or so forth, is there...
Urogynecologist by trade. I still treat kidney stones. I'm still a urologist. We can be reached at, there's a website, My Confident Life 1953.
Wonderful. Dr. Travis Bullock, wonderful. It's always good to have you on the show. Thanks for all this great information.
Thank you.
Hey, thanks for having me on. You guys have a good afternoon. Bye-bye.
Bye-bye. I like that guys get them more than women. We're always, it seems like we always, do you ever feel sort of a weird, perverse sense of satisfaction when a guy, you hear about this whole, it's like.
I like having children. It's so painful. It's like, oh, you have no idea.
Yeah.
But, yeah.
And Jeremy, what do you think about kids? Friends that are like,
not yet.
Like dying?
I have nobody that I've known's had one or
Yeah.
in pain because of one.
Yeah.
So.
Okay.
Well, it doesn't sound like it's something.
There'd probably be some stories, rolling around, of guys, and then of course since they can be so dramatic whenever they get, something
Oh, you're gonna about it.
yeah, exactly. That's what I'm saying.
And it would be a saga of, half an hour over dinner, with friends,
These things that come up, and it's just part of life. And then, my dad will have something, and it's just like, the world has bad, and it's always hysterical. My sister and I are just like busting up,
I know.
And one thing too, also he made a turkey one year, and he's year after year after year, and then the one year he made a turkey. I think we heard about it for years. I mean,
I know exactly what you mean.
All right, we're going to go ahead and take a break. We're going to come back, and we're going to you're going to give us
throughout the day that are healthy. Which of these two options would be best?
Okay, all right. So Jeremy and I we're going to get a little quiz.
We're going to get quizzed.
All right, we're going to have that coming up. Stay tuned to 1380 AM and 1380thewoman.com.
You're listening to 1380 The Woman.